What is the typical recovery time for a gunshot wound? When it comes to gunshot wounds, many people wonder about the recovery time. The truth is, it can vary quite a bit based on several factors. The location and severity of the injury play a huge role. If vital organs or major blood vessels are involved, the recovery process can become more complicated. For minor wounds, recovery might take just a few weeks. However, for more severe injuries, it can stretch into several months or even years. In emergency situations, patients with gunshot wounds typically spend around 9 days in the hospital. Some may need intensive care for about 6 days or longer, depending on how serious their injuries are. For instance, someone with a severe head wound or multiple gunshot injuries might find themselves in the hospital for up to 28 days or more. On the other hand, those with less severe or superficial wounds may be discharged quickly or treated on an outpatient basis. The physical recovery process usually involves wound healing, pain management, and possibly surgeries. Rehabilitation, such as physical therapy, is often necessary to regain function, especially if muscles, bones, or nerves are affected. Complications like infections or the need for additional surgeries can make recovery longer and more challenging. But recovery is not just about the physical aspect. Many survivors face psychological and emotional challenges as well. Issues like anxiety, post-traumatic stress disorder, and depression can arise after such traumatic experiences. Social difficulties, including unemployment or increased substance use, may also occur. Long-term care that includes mental health support and counseling is essential for improving overall recovery outcomes. In high-risk professions like logging, deep-sea fishing, or storm chasing, workers encounter unpredictable dangers. Gunshot wounds representing a serious type of trauma that requires immediate emergency response and ongoing recovery efforts. Just as these jobs demand resilience and specialized safety measures, managing gunshot wounds requires coordinated medical intervention and long-term support. To sum it up, the typical recovery time for a gunshot wound is highly individual. It often involves weeks to months of hospital care and rehabilitation, with ongoing attention to both physical healing and psychological well-being.